This is a presentation on the effects on in-utero drug exposure by Chazelle, Denise, and Amy. Although substance use among pregnant women is underreported, several studies do have statistics on the prevalence of substance use amongst pregnant women. 33% of pregnant women report using alcohol, 20% report using tobacco, and 4.3% of pregnant women report using illicit drugs. Illicit drug use among pregnant women ages 15 to 44 is a whopping 5.4%, according to a study in 2016. According to our findings, there is limited research on the impact of illicit drug use during each trimester. However, we did find one article that discussed the vulnerability of the fetus in each trimester. For example, in the third trimester, the cerebellum is especially vulnerable. In the second trimester, the cerebral cortex is vulnerable. During the first trimester, if alcohol is consumed, an increased risk of spontaneous abortion and fetal death occur. Thompson et al. In 2009, as well as Erner et al. In 2012, both found that prenatal alcohol exposure causes cognitive impacts. Erner went further and suggested that alcohol in utero exposure led to average IQs ranging from borderline to low average ranges. This diagram shows the effects of alcohol in the womb. It gives a visual demonstration of the increased chance of fetal alcohol syndrome, the increased chance of stillbirth, the increased chance of cerebral palsy, increased chance of miscarriage, and increased chance of low birth weight. This diagram shows the effects of alcohol in the womb, specifically fetal alcohol syndrome. Light to moderate alcohol consumption during pregnancy reduces IQ and other cognitive measures in children. Binge drinking can elevate these deficiencies to full-blown fetal alcohol syndrome. According to Erner et al., there is no association with maternal cigarette smoking and executive functioning. However, other studies disagree with these findings. In 2011, a study stated that prenatal cigarette exposure impacts speed of executive attention. This diagram shows the effects of tobacco in the womb. Studies have demonstrated negative effects of prenatal marijuana exposure, including slower response time and increased fetal stress. Prenatal exposure to methamphetamines leads to difficulty with attention and long-term spatial and verbal memory. Cocaine also negatively impacts the fetus, specifically with language. Prenatal cocaine exposure causes decreased head circumference, body length, and body weight at birth. Interesting, these findings have revealed that the head circumference size is not related to cognitive functioning. Studies have found links between fetal alcohol exposure and deficits in children's learning and memory. Prenatal cigarette use also increases the risk of learning disabilities. In a study amongst 145 children ages 13 to 16 who were exposed to prenatal marijuana were found to have significantly negative performance on the Peabody spelling test. Children exposed to prenatal cocaine had negative effects on language skills, impacting reading ability that persisted in school-age years. Those that are exposed to cocaine will require special needs programs. Prenatal exposure to methamphetamines increases stress and decreases achievement.
There are studies that for fetal alcohol syndromes that date back to 1968. There has been some of the changes are apparent very early in life, suggesting that some of the basic building blocks of social behavior and empathy are abnormal. and so it causes difficulty later in life. As the slide, as you see, infants with FAS or exposed to alcohol during pregnancy show high levels of irritability, temperament variables shown to contribute to maladjustments in attachment. And we know about attachment theory as we have studied that in some of our other theories, and some of the indicators that come from a detached family environment, and possible indicators of later difficult temperament and behavior problems in the child. And that was brought to us by Kelly, Day, and Strigos in a 2000 study. In the same population of children in school, where of course behavior can sometimes be a major issue in the classroom, what they found is that mothers who drank alcohol throughout pregnancy compared to those who did not, or those that stopped drinking in their third trimester of pregnancy, or didn't drink at all, that the aggression was much more with those that did drink. And according to Inner et al., 2012, there are no associations found between utero alcohol exposure and attention deficit hyperactivity disorder. And so even if you see there, we do have some contradictions in studies, but that's the finding that we have there. And but what we do know is that we have some gross indicators of social maladjustment, which could actually lead to some arrest and other difficulties in life, also including to the extreme of suicide. What I found to be interesting in my research is the studies that found and linked prenatal alcohol exposure to mood disorders, such as separation anxiety and oppositional defiant disorder. So with the tobacco and behavior issues when it comes to the exposure of prenatal tobacco use, what we found is that there is some effect that is caused there, that can include hyperactivity, negative externalizing behaviors, and these things, as they continue to grow into adolescence as well as into the adulthood, what we found is that delinquency rates increase, criminal behavior, as well as some of the substance abuse being caught up with that lifestyle happens as well. And so what I found in the studies is that with marijuana use, there are some adverse actions that do take place for that baby once they are out and in the world. And what we found is that, of course, yes, the hyperactivity, the impulsivity, and attention symptoms are all there, as well as delinquent behaviors. So in this slide, I am basically showing that boys that have been exposed to fetal syndrome really are affected. In fact, 60% of young adolescents with that come in contact with the law. These boys that are ages 9 to 14 have crimes that are included against persons, which include theft, burglary, assault, and murder. Another study that we looked at gave evidence that attention to problems and adaptive behavior during early elementary school is part of the issues caused by tobacco. And with the social skills regarding marijuana, children do have attention deficit disorders or ADHD, procrastination, or they are overwhelmed and restlessness comes there. And of course, those things can play out when they are trying to socialize, as well as language, because that is part of socializing. Oh, we didn't push press. Wait, I'm not ready yet. Okay.
How did I do that? Because I'm on.
So when we come to the counter arguments in our research, any good research is going to leave you with those. So what we did find is that prenatal nicotine exposure and the behavior problems in children remain to be a challenge on finding really whether or not that is concrete or not. We also were able to find out that there are contradictions in the exposure to heroin and prenatally with regard to the cognitive and behavior issues. And the last thing that we also found in our study with the contradiction is whether or not cigarette smoking and what deficits that the child would actually have later in life.
According to Erner et al., long-term consequences of prenatal alcohol exposure leads to lifelong assistance in order for that person to function at optimal level. All children, no matter their social economics, who have substance abusing parents, have multiple environmental risks, such as unstable and disorganized households, physical and emotional abuse, neglect, and poverty.
Many treatment programs exist for pregnant women who are struggling with substance use and addiction. Some of those are outpatient chemical dependency assessment programs, intensive residential inpatient detox programs. Others are more comprehensive treatment curriculums such as SAMHSA, special state-funded projects, and also pharmacotherapies exist for mothers who are struggling with nicotine, alcohol, and opioid addiction. Step in treatment for pregnant substance abusers starts with the right screening tools during prenatal and postpartum care. How screening is handled can impact significantly pregnant women's use of that prenatal care. If they fear adverse consequences or any judgmental attitudes, they may often delay or even avoid prenatal care. Pause. The use of universal screening tools provides the practitioner with the opportunity to talk to every client about the risks of alcohol, illicit drugs, prescription drugs, and tobacco, and any other substances, including risky behaviors. Structured screening built into the care of every pregnant woman helps eliminate educated guessing and practitioner biases and attitudes. Common screening tools include the CAGE, the TASTE, the MAST, and the DAST. Included in the questions on the TASTE are questions such as how many drinks does it take for you to get high? Have people annoyed you by criticizing your drinking? Have you felt the need to cut down on your drinking? Do you need to have an eye opener to get started in the morning? This chart that you're looking at shows the different types of screening tools, the situations they're good to apply for, and whether or not training is available and required for use of each tool. This is a great cheat sheet for counselors to look at and reference in the case of a client who is a substance user. Women who need treatment for substance use disorders often have different issues than men and non-pregnant women. Pregnancy can further complicate treatment needs. Issues to consider and risk factors are psychosocial issues such as family and history use of substances, physical or sexual abuse as children, history of sexual assault, any violence in the home or history, partner with substance abuse disorder, issues, any cultural barriers, unresolved parenting issues, homelessness or insufficient resources, such as transportation and lack of childcare and nutrition, and also any mental health conditions. Often pregnant women forego prenatal care because they fear the shame and the stigmatization that care providers often give to them. They fear being reported to social services, losing their children, and public benefits such as welfare and food stamps. American College of Obstetricians and Gynecologists reports that some states are using the legal system in a punitive manner to force chemically dependent women who are pregnant to seek treatment. In many states, resources for pregnant women are limited. In 17 states, drug abuse during pregnancy is treated as a form of child abuse. In 3 states, pregnant women who abuse drugs may be committed to a mental health facility or addiction treatment center against their will. Only 19 states offer drug treatment programs specifically for pregnant women, and only 9 states offer priority admission to drug treatment programs. 36 states currently have statutes recognizing embryos or fetuses as potential victims of homicide and other violent crimes. Punitive approaches to treatment, including charging women with child abuse for substance use while pregnant and removing the children, can cause trauma and stress, as well as barriers that make it less likely that women will receive any health care services, including not only treatment for the substance use, but also beneficial services for the infant, such as prenatal care. The research shows that residential rehabilitation treatment is probably the most effective intervention for long-term abstinence for pregnant women. A study done by Milligan and Associates showed that pregnant women involved in long-term residential rehabilitation showed improvement in reduced substance use, improved employment, fewer legal problems, fewer mental health symptoms, and a more positive attitude, as well as fewer high-risk behaviors. In contrast to policies that focus on law enforcement and punishment of pregnant substance users and abusers, lawmakers should consider programs that incorporate preventive strategies such as prevention, early intervention, and treatment of substance use disorders in women of reproductive age. A prevention approach is designed to address root causes rather than symptoms by developing and instituting policies and programs to help address personal challenges that might even lead women to seek coping strategies in substances in the first place, including the stresses of mental health, traumas, physical and emotional abuse, and challenges of living in an impoverished environment. One such program is the SAMHSA Continuum of Care curriculum, illustrated by the diagram in front of you. This more holistic approach to behavioral health spans from community health promotion through recovery. Programs like these will be effective treatments that will be culturally appropriate, women-centered, and meet women's complex and unique needs. These include treating other physical and mental health conditions and providing support to reduce the barriers to treatment, such as child care challenges and transportation issues. Harm reduction strategies aimed at reducing the negative consequences of drug use can also be incorporated into such programs. In our preparation for this project, our findings concluded that future research should probably include in utero effects on antidepressant medications and other commonly prescribed drugs, more information on residual effects on future generations. Research could also focus on guiding medical recommendations on prescription of cannabinoid drugs, and also more information regarding the stage of pregnancy and substance abuse. Future research should definitely address specific stage of pregnancy to better inform medical professionals and the public regarding issues relating to treatment outcomes. Here are some questions that we would like you to consider as you view this presentation. What power do you hold in your role as a licensed therapist to reverse persistent social stigmas of pregnant women with substance use disorder? How might recent marijuana legislation impact treatment programs for pregnant women or even others? How would you handle a session where your pregnant client discloses substance use to you? According to the laws in your state, are you legally obligated to report? Here we have provided some resources and tools that you can use to inform yourself or share with your client.